So just a word about boosters still. People have to understand what boosting is. Really, boosting is probably an unfortunate term, because what it really should be thought of, for the messenger RNA vaccines anyway, is a third shot in a 3-shot series. So what we know now from how immunity wanes and with the messenger RNA vaccines, after 5 to 6 months in particular, it starts to wane. That the third shot boosts that and contributes to immunologic memory so that you respond better if exposed. And so it's really kind of like a lot of other R vaccines that we use in 3-shot series, such as human papillomavirus, HPV, hepatitis B virus, the old shingles virus, and there's probably a lot of vaccines, pertussis now, whooping cough. That really should be a 3-shot series. And a lot of those already are. So Omicron is going to be that way. The ACIP has a bunch of meetings on the calendar in the next few weeks. I'm guessing that one of them is going to be a meeting to look at what we're going to call fully vaccinated. And I'm guessing that we're going to be calling 3 shots fully vaccinated rather than 2, because that's the way it probably should be. And that's what some places in Europe have already done. I think we'll be following suit with that. So what can this third shot do for you? Is this third shot a complete shield that's going to protect you 100% for Omicron? No. What it's going to do is make it a lot less likely that you'll get symptomatic Omicron. Looking at all of the data put together, it takes about a 35 to 40% risk, a 35 to 40% chance of being protected, to about a 70 to 80% chance of being protected, which is a pretty good, but that still means about 30% of people might get a symptomatic infection. But when they do get infected, they get colds, and the colds don't last long, and people shed virus a lot less, longer, and that means there'll be less transmission with it. So getting the booster for a population of people will slow transmission in that population. That's the postulate, and I believe that to be true. So for certain populations of people, it really makes a lot of sense for everyone to get boosted, such as a university population, or a prison, a nursing home, places where there are a lot of people in close together. And that's why a lot of our universities are asking the students and mandating boosters for them to come back for the spring semester. Will there be a 4th shot? Well, at some point we're going to just have to stop boosting, because we can't keep boosting the entire world every 6 months. And eventually immunity will become such so that it'll be a COVID cold for everybody. So who is going to be left out are going to be the unvaccinated people. And I'll tell you, if you're unvaccinated, you will get Omicron. No ifs, ands, or buts. It's going to happen.